22 at the EMA office, where we bring you the latest information on our COVID testing and our hopefully the vaccination and a little bit of everything on this Friday. Joined here with Assistant Director Brian Whitaker and Chairman Mark Hearn. Gentlemen, it's been a busy day. And we got a guest today with us, joining us by Zoom. So, Chairman, you want to introduce Lynn?
Sure. So we're joined today by Lynn Benhouse, who brings with her an interesting perspective on catching COVID and just what to look out for, and perhaps some useful pointers that Team St. Clair can use to maybe keep this away from their doorstep. Lynn, how are you feeling?
I'm feeling much better. It is something else. That's what I describe it as, something else. Because yeah.
No, good.
It is the fatigue that everybody talks about will take you down. And you will have it. Even when you're getting better, you can have like 4 naps in a day. It's that power. Until you experience it, you don't know what that fatigue does. Now, I had a mild case. I did not have to be hospitalized. I will say, get one of these. It's an oximeter, and you put your finger in it and it judges your oxygen level, and you should be between 90 and 100. If it goes below that, you better seek help, because that's what COVID does. It's attacking your lungs. It's trying to get in your lungs. So you have to do everything you can to keep it out of your lungs. Now, I thought I had a bad cold. I thought it went into a sinus infection. So I went to an urgent care and they asked me if I wanted to get tested. And I said, yes. And they said, you're positive. So even if you think it's a cold, it might be COVID. So I think it's easier to go get tested, because I think the earlier you can deal with it, the better you will recover. It's not going to be so harsh. There's no rhyme or reason, because our DNA doesn't recognize this virus. And so our immune system is trying to fight it. So everybody's different, I think. Like, I ran a low grade fever a couple of times, but nothing high. And they also told me to take over the counter cold medicine, take Tylenol, lot of fluids. You have to drink a lot of water. And also, because you don't want it settling in your lungs, I elevated myself when I slept, so I wouldn't be laying flat to get anything in my lungs. And also, breathing exercises are really good. And I do think everything that they tell you to do, like what you guys have been telling everybody to do, you have to do. You have to wear a mask. You have to be socially distant. You have to stay out of poorly ventilated places, avoid crowds, because I have been very, very good about this.
And this actually, this came to your doorstep. So, you've been very careful, and yet you think you might have contracted this because of a shared apartment system, huh?
Right. My neighbor knocked on my door, and I opened the door without my mask on. And then a couple of days later, she found out that she had COVID. So she told me that. But yeah, we all had it. And so we're senior citizens. So of course, I think the anxiety of having it, because you don't know what'll happen, but you just got to trust the science, trust the medicine, tell them what, that you should do. Because I really do think even just for a few minutes, I didn't have a mask on.
You just don't always think about that, especially if you're in your own home.
Right. So when people come to the door, wear your mask. And even though she stood away from me and everything, I mean, I don't know how else I got it. But I do think everything you guys are telling everybody is really important, because it seems to be spreading faster. It seems to, we have, different people have lingering effects. So it might affect you. I'm very fortunate. My children are grown. I don't have to take care of a family. I don't have to work outside the home. So I was very fortunate that I could sleep a lot, but not everybody can do that.
Well, we're we're glad that you're feeling better, and you haven't really experienced any long-term effects, or at least you don't believe you have those right now. Is that right?
No, I do think, yeah, I do think you will have a cough for a while. You know, it comes and goes. It'll all of a sudden, you'll just be coughing, having a fit. And then I also do think that if you overdo it, you get tired easier, and the next day it's really hard. So it just depends on how well you take care of yourself.
Well, we appreciate you, and we're glad you took care of yourself. I think our other members of Team St. Clair, other than you, they know your name. They know that you're a journalist, and so you've really put this together very succinctly for all of us to let us know this is out there, this virus. For anybody who says it isn't, they're just plain wrong. And you're a living testament to the fact that if you take care of yourself, and you actually gave yourself, we're taking supplements all throughout this just as a precautionary measure.
Yeah. Yeah, a vitamin D and zinc, which doctors said last year. I've been taking that for a year, and I really do think it helps.
Well, that
Vitamin D and zinc, and my uncle that is in assisted living, he had it, and they were having him take it. So, and he recovered really well. So there's got to be something to this vitamin D and zinc. And yeah, just listen to, I would say if you think you have it, even if you are not sure, go get tested, because the quicker you're under care, the easier it is to, to help hopefully get through it. But it's not easy at all. I mean, it's real. What you're saying is real. This is not a hoax. This is not made up. This is not like a little thing.
great. Herb?
Well, then we really appreciate it. I've Team St. Clair, because we have a lot of Team St. Clair members out there who has been worried about this for days, 322 of them to be exact. And I really appreciate you coming on here today, sharing your story, and we wish you a speedy recovery with the rest of it.
Well, thank you very much. I hope I can help someone. I think that the more we know about it, the better it is, because it is different with everybody.
Very good. Thank you very much, and you have a
Thank
good
you.
weekend. Thank you.
Be safe.
Thank you. You too.
Thanks,
Be
Lynn.
safe.
Thank
Wear
you.
your mask.
Thank you. We are.
We'll go to Brian now for the numbers.
Thank you. So, as of today, we have tested 252,374, which is an increase since yesterday of 1,703. Positive test results, we've received 25,835, which is an increase of 117 since yesterday, and those are males and females under the age of 10 up to their 90s. That brings today's daily county positivity down to 6.9%. For negative test results, we're at 226,539. For deaths, unfortunately, we are adding one new death today. That was a female in her 80s, and she did have underlying health conditions, bringing our total in St. Clair County to 408, and our thoughts and prayers are with her family. For those that have completed their IDPH required 10-day isolation period, we are at 24,210. For state totals, they've tested 15,844,619. Positive test results are 1,120,528. That's an increase since yesterday of 4,156. For deaths statewide, they have an increase of 71, bringing the statewide death total to 19,067. For hospitalizations, we will start with those in St. Clair County hospitals. We have 87 patients admitted due to COVID-related illness, and unfortunately today we are up to 8 patients on ventilators, quite an increase since yesterday. Regionally, we are at 158 COVID-related patients admitted, and 14 of those are on ventilators. For our congregate living facilities and outbreak status, and these are cumulative numbers, those that have changes today include Cedar Trails of Freeburg. They have 34 cases and 2 deaths, which is an increase of 1 case and 1 death. Mercy Rehab in Swansea has 50 cases and, has 128 cases and 18 deaths, and that is an increase of 1 case. St. Paul's Home in Belleville has 155 cases and 28 deaths. That is an increase of 1 case. And finally, Sycamore Village in Swansea has 37 cases and 1 death, and that is an increase in 3 cases. I will now turn it over to Chairman Kern for his update.
Thank you, Brian. And thanks for all your work at the fairgrounds today. You and Randy and Herb all put in a full day with Mila from the health department, and Sam, and then the whole crew of the National Guard. Everybody's pulling together. This site is really going to be something. We're going to talk more about that after we get done with the zip code. And I see Herb looking at me saying, get to the zip code. So here I go. 62201 up 3 to 544. 62203 is up 1 to 569. 62204 up 1 to 362. 62205 up 2 to 595. 62206 up 2 today to 1180. 62208 up 6 to 1452. 62220 up 11 to 1819. 62221 up 11 to 2469. 62223 up 4 to 1537. 62225 up 1 to 128. 62226 up 11 to 2843. 62232 up 3 to 818. 62239 up 3 to 417. 62240 up 1 to 143. 62243 up 6 to 666. 62254 up 4 to 731. 62255 up 1 to 67. 62257 up 6 to 306. 62258 up 3 to 930. 62260 up 8 to 701. 62269 up 18 to 2916. 62285 up 5 to 492. As Brian said, 117 new COVID positives in the county today out of 1,703 tested. Brings our positivity down to 6.9% today. The rolling average, though, is up to 8.9%. Regional positivity, how the state views us with the other counties in the region, we're down today to 7.2% in the region. We're below that magic number of 8% that the state set up for us, but since our ICU occupancy is still too high, we're at 18%. We need to get to 20% available beds before we can open up to inside dining, and we're forever monitoring that number, and hopefully we get some inside dining opening pretty quickly. The rest of the counties in the region, Bond County is 1.1% today, Clinton's 6.3%, Madison 8.6%, Monroe County's 15.4%, Randolph is 2.7%, St. Clair 4.2%, and Washington County 8.3%. So Herb, those numbers they're looking better, and that combined with the fact that we're ready to roll out, and we're prepared to talk about the rollout at the fairgrounds shows that there is a real end to this in sight. We just have to get enough vaccine to get it in people's arms and get that amount of immunity in the community.
Well, and 322 days it seems like forever, and we still got a ways to go. I'm not going to sit here and sugarcoat it, but it is coming together. And Team St. Clair, please, I know you've been tired of hearing us say, the light at the end of the tunnel is there. The testing site at the fairgrounds, we did a training session there today. Kudos, as you said, to Mila and Sam and the health department and everybody who's been down there. We wanted to try to break it, and we
You mean you wanted to try to break the system that
Yes,
we had set up
yeah.
by bringing people through
Yes.
vaccinating and find out where the flaws are. So when this site opens on Monday, and it's going to open on Monday, and you can go on right now. If you make sure you're signed up to be contacted, and those who have been contacted are signing up to be part of the first
You
group
have to
on
have an
Monday.
appointment.
You have to have an appointment. You can't just
show
drive.
up, because if you do, you're not, and if we had the unlimited vaccine, yes, then anybody want to show up, but we have to be able to pre-schedule this, and that's what's been going on today. So a lot of people have been getting phone calls and emails today. The call center that we set up has been busy confirming that. So if you are one of those that above the age of 75,
75 and above.
and that will be scheduled for Monday. When you come there, you'll see the work that we've been talking about for the last week and a half that we've been working on to get this mass site set up with the National Guard, the Health Department.
But this isn't just about one day.
No.
This will be a 6-day-a-week site, and so depending upon the amount of vaccine, and we believe we have enough vaccine to get us through next week, and the goal is 1,000 people a day. The first day, we're starting a little shy of that, just to make sure that when we bring that large quantity of people through, we can handle that, and then we're going to ramp up with our partners from the National Guard.
Hospitals.
The hospitals, for sure, and we're so appreciative of our state representatives and state senators who are just doing a great job for us. They're really all pulling in the same. We're all pulling in the same direction. Team St. Clair is going to deliver the first mass vaccination site in southern Illinois, certainly maybe even in central or southern Illinois, and it's going to be operational. Matter of fact, it was operational today for a small group to try to break the system. And by the way, made a few changes and it worked.
And that's what we wanted to do. We wanted to work those bugs out of it, so when we open up Monday, it's a smooth transition. But so one of the most important things, and we say this every day, if you haven't went on to either the EMA page here on Facebook and pre-registered your interest, or on the county health department's page, or on the county webpage, you need to do that, because as of today, 53,055 citizens have signed up for that. So please tell your friends, your families, get on there, because that's how you're going to be notified when we have that surplus of vaccine, the extra amount that we will be notifying those who have signed up. You have to have an appointment. I can't stress that. We've worked with the St. Clair County Transit District. So, we're covering all the bases. And Brian, we've been down there all day. We're going back down when we get through here.
Absolutely. And one thing that I want to stress, something I know they've heard a lot in the call center today, is I am 75 or above. I am signed up, but I haven't got notified yet. That's because they are notifying based on the limited amount of vaccine they have. They're taking the ones as they've signed up in order. And if we have 1,000 doses, they're taking 1,000 over 75. And we have over 9,000 in that category, just 75 or older, that they're working through. So it's not that you were forgotten. It's just we're working through to get there. I saw a question on the feed earlier today that someone's parents got a call from Belleville Memorial. We are working with our partners at Memorial Hospital, HSHS, Southern Illinois Healthcare Foundation, and Touche, also sharing that list with them. So it is possible that you might not get called or notified to come to the fairgrounds. It could be St. Elizabeth's Hospital. It could be Belleville Memorial. Follow those instructions they give you, and that's going to be your earliest opportunity to sign up for that appointment.
And you still, Walgreens is available to sign up there too. The vaccine comes to the health department, and we distribute that throughout all our partners. Southern Illinois Healthcare Foundation and Memorial and St. Elizabeth's, they get these doses, and we then distribute it. Nobody's sitting on it. The idea is to get needles in arms, and that's what we're doing. And also, I've heard a couple people say, well, how about people that are not computer savvy? Are they going to be able to be notified and sign up? And we've made provision for them. They'll be called on their phone, on their landline, if that's what they have, and then someone will help them to sign up. I heard a number of operators today that are working out of this building that are so caring and so kind and working just to get people signed up and get them inoculated. That's the key. The key is just to bring this community together and let's get these vaccines out.
Yeah.
Very true.
And I did an interview with media this afternoon, and they asked that question, and They want to know what other safeguards to where we make sure that none of our citizens fall through the cracks, and we're covering all those bases, and we think we've got them all covered. If there's something out there that we have forgotten, we will address it immediately. So we are working around the clock on this. I see some of the comments today on here that Memorial's operations was real smooth. So as you said, our coalition with our hospital partners, and that's what this is all about. It's not about who's going to give the most. We want to get as many needles in the arms of all of our citizens that we can. And with Team St. Clair's help, getting the word out there. But be patient. That's the operative word, is be patient, because we can only provide what we have the product for. The chairman is working daily with the state representatives to try to get as much of the vaccine here to our county as possible. I can guarantee you he's going to continue to do that. And so far, we've been going to get ready to do this Monday morning. So those of you that have been called, please be patient with the staff down there. It's going to be a process that I think you're going to say it's well worth it. And we're going to make sure you get that needle in your arm and get your first one shot, and then we'll get more vaccine, and we'll continue to go. It's not going to happen overnight. 322 days we've been here. We know you're tired of seeing us, you're tired of hearing us, but we're going to stay here until we get it done. And I think we have Cindy or Daisy a little bit longer today, but we will get them in here and translate it into our Spanish community. And please, remember that word, be patient. Everybody's doing the best they can. We'll be back tomorrow for day 323, and everybody please have a good evening and a good weekend.
I have battled this virus both professionally and personally. Professionally, I can tell you firsthand that it's greatly impacted our community, caused the loss of many lives, and continues to spread today. Personally, I can tell you that I contracted COVID-19, and it definitely is not the flu. This virus affects everyone differently, however, many have severe consequences. Please take this time to help your friends, your family, your neighbors, and the entire region by wearing a mask, washing your hands, and watching your distance. Together, we will overcome this invisible enemy.